If penetration, whether that's a tampon, a medical exam, or intercourse, are painful or impossible, you're not alone. And most importantly, it's treatable. Vaginal dilators are one of the most effective tools to train the pelvic floor muscles and the vaginal tissue to relax to support goals of pain-free penetration. And today, I'm going to walk you through exactly how to use them. I'm Amanda Olson. I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And I designed the Intimate Rose dilators because what was on the market was not comfortable enough for my patients. To begin with, wash the dilator with warm water and soap. Be sure to sing the happy birthday song so you wash it thoroughly and use warm water because that's going to help warm up the dilator. Next, you're going to pat it dry and inspect the silicone for any cracks or any changes. Next, you're going to be sure to use plenty of water-based lubricant. Our water-based lubricant, Serenity, is the perfect formulation. It's FDA cleared. You're going to use a tablespoon of lubricant on the dilator and a tablespoon on your body to ensure that there's a nice glide and to prevent any restrictions or any pain during insertion. Next, find a quiet place in your home where you can fully relax. That might be your bedroom or it might be someplace else like your office or your closet or even the kitchen. Just a place that is really soothing and comforting to you where you can do your dilator training. The focus here is on breathing and retraining the pelvic floor muscles and working with the tissue. So avoid scrolling on your phone, stay present, and lay on your back with your knees bent. You can place a pillow on either side of the knees to help relax the legs. Or if that's not a comfortable position on your back, you can also lie on your side with a pillow between your knees. Before inserting anything, begin with a breathing practice. Inhale through your nose for a count of 4, and then out through your mouth through a count of 4. The diaphragm, where we breathe from, and the pelvic floor muscles work together as a team, similar to a piston. So when we inhale, the pelvic floor muscles relax, and when we exhale, they gently lift back up and return to resting state. If you notice yourself holding your breath or clenching at any point during your dilator training, be sure to take a pause and check back in with your breath and go back to the inhale, 2, 3, 4, exhale, 2, 3, 4. A lot of people find it helpful to imagine that their pelvic floor muscles are like a rosebud. And when you inhale, the rosebud is going to drop and expand and open. And then when you exhale, it's going to close back up. So inhale, imagine down and out, and then exhale, it closes back up. Another visual tip that some people find helpful is to imagine that you are a chicken laying an egg. I know it sounds silly, but that gentle little drop and expansion, as if you were going to gently lay your egg, you don't want to break your egg, is helpful to drop and expand the pelvic floor muscles, especially on insertion. As the dilator approaches the vaginal opening, be sure to keep breathing and to check in with yourself to see if you're clenching. The clenching might happen in the pelvic floor muscles. It also might happen in the jaw or in the shoulders. Try to do a body scan and release and continue to breathe. We don't ever want to force the dilator, so take it very, very slow. As you approach, imagine that expansion like a rose, or you're a chicken laying your egg. Insert and wait, and just gently insert as you're able to. It's okay if you don't get the dilator all the way in. The goal here is to retrain the brain and the pelvic floor muscles to relax. And if you're noticing the clenching, that's the first step in the right direction of noticing. And that's how we work to retrain the brain and the pelvic floor muscles. Once the dilator is all the way inserted, you're going to leave it in place for 10 to 20 minutes. During that time, we're working with the tissue to get that gentle load to improve length and width and flexibility in the vaginal tissue, and we're training the brain and the pelvic floor muscles to remain relaxed. So during this time, you can work on manipulating the dilator as well. If it's pain-free to have it inserted, you can practice removing a little bit and reinserting. You can gently glide it from right to left. And then from there, you can also work on the clock technique, where 12 o'clock is the top of the vaginal opening and 6 o'clock is the perineum. You're just gonna glide down and hold for 30 seconds to 2 minutes, and then release and go to 7 and 8 and all the way around with special gentle touch around 12 o'clock. When you glide up, just use a feather touch because the urethra is on the other side of it, and if we push too hard, it can irritate the urethra. So feather touch, but just gently manipulating it all the way around the clock. Or you can simply just breathe during that 10 to 20 minutes. Again, avoid scrolling on your phone or watching TV. We want you to remain engaged and noticing what your body is experiencing, and to unclench if your body starts to guard against the dilator. Aim to practice using your vaginal dilator daily. That daily practice helps to train the tissue and your brain, and you're going to reach your goals faster. If you're feeling a little bit sore, you're not feeling well, or you've had a really rough day, it is okay to take a day off. Just don't let one day turn into 1 week. That massed practice is going to be what gets you towards your goal. You're ready to move from one dilator to the next when the dilator that you're working with is easy to manipulate and easy to maintain for that 10 to 20 minute period. And you've done the clock method, and it's okay with your body to check in and push into that different tissue. Then you'll move on to the next dilator. Once you've reached your goals with using the vaginal dilators, you can do a maintenance program of 10 to 20 minutes 3 times a week. And there also might come a day when you reach your goal and you don't need your dilators anymore. Don't throw them away. Sometimes when our health status changes, or we go through life, or we go through a stressful period, our body might have that guarding reflex again, and we might just need a little tune-up using the vaginal dilators. But for most people, they get to a point where they're using them minimally or not at all. If you're not sure where to start, a good place is to have an evaluation by your physician or your pelvic therapist to help determine which dilator you're going to start with. And that will help you determine what your path is towards your end goal that is specific to you. The smallest dilator is roughly the size of my pinky. So that's a good goal to start with if you're having significant amounts of pain or pelvic floor muscle restriction. They gradually get a little bit larger and wider. And then your end goal, if it's a speculum exam, is going to be roughly size 4. And if it's pain-free penetration, roughly the size of your current partner, if you're partnered. If you're not currently partnered but would like to be someday, getting to roughly size 6 or 7 is a great goal that's towards the average. You can find the full dilator set as well as our water-based lubricant at intimaterose.com. You can leave questions here in the comment section, and I might turn that into my next video. You can also discreetly and privately email our support team at support@intimaterose.com, and I'll link all of that information here in this video as well.